My name is Angela, I'm 52, I live in West Sussex. I underwent breast reduction surgery at Benenden Hospital in April 2024. Prior to surgery, I never liked changing in public changing rooms, and it was very difficult to find any swimwear or lingerie in my size. I'd have to go to specialist shops, which were always a lot more expensive. I never liked looking at photographs of myself because of the disproportionate size of my body. And it was at Christmas that I went for a bra fitting, and I'd increased in size by another cup size. And my husband wanted to buy me a dress at Christmas time, and I got very frustrated in the shops because I couldn't find anything that would fasten at the back. It fitted me on the bottom, but so I elected at that point to say, this is enough, I really want to have the surgery. I've been a Benenden Health member for over 20 years, and when I was looking for reputable surgeons, Mr. Mackey appeared, and as a member I explored further, and he was a very reputable surgeon. I also knew Benenden Hospital would provide excellent post-operative care over a clinic or just going to a cosmetic surgery clinic, so I decided to investigate further and book my initial consultation. At my first consultation, I met Kate Comrie. She's the specialist cosmetic nurse, and she immediately made me feel at ease. She was very friendly, very professional. She took me through to meet Mr. Mackey, and again, he made good eye contact. He didn't use medical jargon. He made me totally feel at ease, and he explained the procedure. He also explained that I may require some liposuction under the arms, which would certainly help with my overall frame after the procedure. He was exactly what I was looking for in a surgeon, very personable and professional. So after the first consultation, it was explained to me that I would require a second consultation so that I'd had time to process all of the information that I'd been told, and if it was something I definitely wanted to go ahead with at the second consultation, then I would sign the paperwork and a date would be agreed when I would be coming in to have the surgery. So the drive through the countryside is just beautiful, especially in spring, coming along in April. On arriving at the hospital, the car park had lots of free spaces. It's directly next to the main entrance, and I was greeted by a very friendly receptionist who directed me to the cosmetic suite, which was very clean, bright, very calming, and the feel of the whole hospital is the cleanliness. All the staff you encounter, from the porter to the nurses, are very, very personable and friendly. I was really impressed with the room. I had a lovely sized ensuite, and then very shortly afterwards, once I'd had time to settle in, I met the anaesthetist and everybody that would be assisting me throughout the day. Kate Comrie, the cosmetics nurse, was there. She came in with Mr. Mackey, and immediately it was nice to see a friendly face. Mr. Mackey then had to draw on my breasts where he'd been making the incisions, which did make me feel very nervous, but he assured me that that wouldn't be the scarring, and that it was just to assist him throughout the surgery. I was concerned about the nipple area because I knew it would have to be removed. Mr. Mackey assured me that they would keep the blood flow and the nipple area attached if they could, so it would ensure that the tissue would survive when reattached. Mr. Mackey came to visit me probably around an hour after I'd come round after the surgery. He explained that everything had gone very well and that he took the compression off to show me the scars. I was quite apprehensive at first, however I became quite emotional when I saw my shape in the mirror, and I just had feelings of regret that I hadn't had the surgery done a long time ago. They looked perfect to me, although obviously I had tapes on where the scars were. It was such a vast improvement. I thought I would be in a lot of pain, but surprisingly I could manage the discomfort with paracetamol that I just was recommended to take every 4 hours. I had 2 compression bras that Kate had, before the surgery, recommended that I bought, and then I changed them to help with the recovery. I had tapes on the scarring, which were removed after 6 weeks, but they stayed on for the entire time. Every time I would catch my reflection in a shop window or the mirror at home, I just couldn't believe. I kept smiling and couldn't believe the new shape. My posture improved, my clothes fitted better. People commented that they thought I'd lost a lot of weight, but they weren't quite sure that I'd had the surgery to reduce my breasts. At my 6-week post-op, I was again met by Kate Comrie and went through to see Mr. Mackey. He was very pleased with the results. The scarring was symmetrical, very neat, and after the initial surgery they did appear very high and quite firm, but I was reassured they would drop and be more natural, which once the swelling had subsided they certainly did look a lot more natural. Mr. Mackey was very pleased with the results. The tapes were removed and I was told that I could go for a bra fitting to find out my new size. It has totally changed the way I feel about my body, and I used to be an H cup prior to the surgery, and then I went for a professional bra fitting and was measured as a 34D. Now all the underwear in the regular stores are accessible to me. I purchased 2 swimsuits that are just, they fit perfectly, my body's in proportion. I go to Pilates regularly. I go on the trampoline with my 8-year-old daughter wearing a regular bra, and it has totally changed my confidence and the way I dress and the way I feel about myself. If anybody is struggling with the side effects of having extremely large breasts, I would totally recommend that they come to Benenden Hospital, meet Mr. Mackey, and with his friendly professional team, it's a painless surgery, and 6 months down the line I can sit here and say it was the best thing that I did. I regret not doing it earlier, however it's improved my life in so many ways that I didn't think possible.